muscles, nerves, vessels, and lymphatic drainage of face. So in this, we will be describing the competency related to the origin, course, branches, tributaries of facial vessels. So in the face, there are a number of branches which are supplied, and that includes internal and external carotid arteries. Coming to internal carotid artery branches, the internal carotid artery enters the skull through carotid canal. Then it goes to form the circle of Willis. Ophthalmic artery is a branch arising from internal carotid artery. It courses through the optic canal and enters the bony orbit. In the bony orbit, it gives two branches, that is supraorbital and supratrochlear arteries. They supply scalp of the anterior forehead up to the vertex. Then coming to branches of the external carotid artery which supply the face. External carotid artery contributes several branches to supply the face. The external carotid artery terminates into two branches. One is superficial temporal artery. This artery runs in front of tragus of ear, and it anastomoses with branches of the internal carotid, that is supraorbital and supratrochlear. Then coming to another terminal branch of the external carotid artery, that is the maxillary artery. The maxillary artery courses deep into infratemporal fossa. Here it gives one artery that is called as inferior alveolar artery that enters into the body of mandible, and after coursing through the body of the mandible, it emerges as the mental artery from the mental foramina to supply the lower lip and chin. It also gives one more artery that is called as infraorbital artery. While it courses through infraorbital fissure, and that artery will exit infraorbital foramina, and the infraorbital artery will supply part of midface. Then the facial artery. The facial artery is the important artery that supplies the face. It is a branch arising from the external carotid artery, and it gives a major blood supply to the face. It arises in the neck. And coming to its relations, the facial artery is in close relation to the submandibular gland, and it enters the face by crossing the lower margin of mandible anterior to masseter muscle. Then the artery courses medially towards the angle of the mouth, and near the angle of mouth it gives two labial branches. One is the inferior labial artery that supplies lower lip and chin, and the other artery is superior labial artery that supplies upper lip and also a portion of cartilage of the nasal septum. So it contributes to one plexus that is called as Kieselbach's plexus, also called as Little's area, and this Kieselbach's plexus is located in the anterior inferior part of the nasal septum. Then it continues deep to zygomaticus minor muscle as angular artery. It supplies the nose dorsum and anastomoses with internal carotid branches near the medial canthus of eye. This anastomosis form an important connection between the internal and external carotid arteries. Then we move to another competency, that is branches of the facial nerve. Facial nerve has a roundabout route from the beginning of its course. After its origin is cerebellopontine angle, it enters internal auditory meatus. Then it is in the inner ear, then it is in the middle ear, and then in the mastoid bone, and it emerges to start its extracranial course at the stylomastoid foramen. After exiting the foramen, the nerve immediately gives off three small branches that supply the auricular muscles, which are called as posterior auricular muscles, then posterior belly of digastric and stylohyoid muscles. Then the nerve enters into parotid gland and it divides into 5 terminal branches or terminal divisions. So first one is temporal branches. They course superficial to zygomatic arch to supply the temporal region. So that is, they supply to orbicular circuli, frontalis muscle and corrugat superciliary muscles. Then second one is zygomatic branches, and zygomatic branches courses towards lateral canthus of the eye to supply orbicular circuli above and below the canthus. Then we have buccal branches that supplies zygomaticus major, minor, levator labii superioris, levator anguli oris and buccinator. Then the fourth one is mandibular division. It supplies orbicular oris, depressor anguli oris and mentalis muscles. Then we have cervical branch that courses down into the neck to innervate the platysma muscle. Then we go on to study another competency, that is cervical lymph nodes and lymphatic drainage of head, neck and face. Coming to face lymphatic drainage, we can divide into 3 parts. First one is forehead, then the lateral temporal, frontal and periorbital regions. So these regions drain into preparotid or parotid lymph nodes, and their secondary drainage is into upper jugular chain. Then we have mid-face region that includes glabella, nose, upper lip, medial canthal regions, and this area drains into submandibular lymph nodes. And we have the lower face, lip and mentum, that is near the chin, that drain into submental lymph nodes. The jugular chain serves as secondary lymph nodes for both mid-face and lower face regions. Then we go on to study another competency, that is muscles of the face, their nerve supply and actions. So facial muscles are striated, that is voluntary muscles, and the muscles are attached to the skull of the bones of the skull, and they perform 2 functions, that is mastication and facial expressions. So these muscles of facial expression are located medial to the ears, superior to the mandible and inferior to the coronal suture of skull. Then coming to functions of the facial muscles, they have 2 major functions to perform, that is mastication and facial expressions. Coming to mastication, buccinator is an important axillary muscle of chewing. Then all other muscles, or the majority of the muscles, contribute to exhibiting expressions. So muscles and their functions. Orbicular circuli is responsible for blinking the eye and closing of the eyelid. Then nasalis and labii superioris aliquo nasi are responsible for elevate the sides of the nose as for snarling, that is showing anger in animals. Then depressor labii inferioris depresses the nose. The procerus and corrugator supercilii, these muscles are attached to the frontalis muscle in between the eyebrows and functions in crinking the eyebrows together. We have auricular muscles that function in moving the ears. Then we have zygomaticus major and minor, which function to help in smile. Then risorius, another muscle, and whose function is in smiling and also aggression. Buccinator allows an individual to chew without biting his own cheeks and to blow air outward. The occipitofrontalis helps to raise the eyebrows. Depressor anguli fibers depress the sides of the mouth as in frowning. Orbicular oris functions in pursing the upper and lower lips. The mentalis muscle helps in lowering the inferior lip. Then we go to study the anatomical basis of facial nerve palsy. We can say that there are 4 nuclei which are related to the facial nerve. One is motor nucleus that controls the muscles of the facial expression. Then we have a superior salivatory nucleus that is related to lacrimal gland secretion and also salivary secretion. Then we have nucleus salutarius related to taste for the anterior two-thirds of tongue, and trigeminal sensory nucleus for a small portion of the external ear. Then coming to facial nerve course, as we already discussed, the facial nerve leaves the cerebellopontine angle, enters the internal auditory canal with the 8th nerve, that is vestibulocochlear nerve. Then the facial nerve proceeds through the temporal bone and it gives 3 branches in the temporal bone. So the 3 branches which are given are, one is the greater superficial petrosal nerve. It carries lacrimal and secretory fibers to the pterygopalatine ganglion. Then a branch is given to stapedius and another one is chordae tympani branch, and the chordae tympani branch carries taste from the tongue and sends secretory fibers to both the salivary glands, that is sublingual and submandibular glands. And coming to course of the facial nerve, it exits the stylomastoid foramina, it runs through the parotid gland, it gives 5 terminal branches, that is temporal, zygomatic, buccal, mandibular and cervical branches. Then coming to anatomical basis of facial nerve lesion. Facial nerve lesions above the geniculate ganglion cause ophthalmic symptoms because it involves lacrimal secretion and also orbicular circuli muscle is involved. Then we have central lesions that cause crocodile tears as regenerating fibers of the chordae tympani start supplying lacrimal secretory neural pathway. So lesions can be anatomically divided into 3 types, that is supranuclear, nuclear and infranuclear. Coming to supranuclear lesion, the motor supply of the upper part of face is derived from both the cerebral hemispheres. So in supranuclear lesions that involve the face or facial palsy, functions of forehead wrinkling and eye closure is spared. Then we go to Bell's palsy, also called as infranuclear lesion. Sir Charles Bell gave classic description of this peripheral facial weakness of Bell's palsy. It is the most common type of facial palsy. It affects adults between 20 to 40 years and others also. Men and women are equally affected, and it is characterized by acute unilateral infranuclear facial palsy. Cause of Bell's palsy is unknown. It is mostly an infectious disease. Thank you.